Hello and welcome to Value TV. I'm Marcy Miller. Today I've stopped by Advanced Cardiology Consultants. If you know someone who's had an experience with advanced cardiology in the past 15 years, then you know it is obvious the most important value to their success is the overall care and well-being of the patient. I am here today with Dr. Greg May, one of 6 physicians at Advanced Cardiology and cardiovascular treatment, prevention, and care. Dr. May, tell us a little bit about what's on your heart today.
Well, you know, Marcy, this is February is Heart Month, and I think it's important to spread the word in the community that, you know, we're looking to try to help people and keep people healthy. And there's certain types of patients who they should really think about their risk factors and think about getting checked out before, you know, some bad event occurs. People that have a strong family history of heart disease, any of your relatives that have had heart disease before the age of 55, if you have high blood pressure, if you have diabetes, if you have an elevated cholesterol, or if you're a smoker, these are the type of risk factors that are associated with heart disease, and people should really be paying close attention to any symptoms that they may have so they can get checked out. So
what are some of the symptoms to look for?
You know, Marcy, we see a lot of patients for a lot of different reasons, but you know, I guess our main referral is for people with chest discomfort, and it doesn't have to be pain. It can be a pressure or tightness in the chest, usually in the middle of the chest. People that have shortness of breath, people that have sensation of a racing heart, symptoms of dizziness or nearly passing out. Those are probably the majority of the patients that we see.
Okay. What type of testing do you do to see exactly how heart healthy people are?
Well, after taking a careful history and examining the patient, you know, we come up with a plan individually for each patient. Every patient's not going to get every test. It's going to be fine-tuned to the symptoms and the complaints that they have. Testing might include an echocardiogram, which is an ultrasound of the heart to examine heart function and look at the valves in the heart. It might include a stress test. It could be a standard treadmill test or a nuclear stress test to get an idea about coronary blood flow and if there's any blocked arteries in the heart. It might include a Holter monitor, which is to look at cardiac rhythm disturbances. So those are the mainstay of our treatment plan. Other tests that we might also include would be, you know, lab tests to check for cholesterol elevation and things of this sort.
What would be the treatment process if a test came back showing some concerns?
Depending on the test results, an echocardiogram that showed, you know, some valve problem that wasn't very serious there may not be anything to do. There may just be a follow-up appointment a year later and have another echo. If someone has an abnormal stress test and we're suspicious of blocked arteries in the heart, then obviously those patients are going to need other tests such as cardiac catheterization. And some of those patients may need to go in and have angioplasty or a stent placed or even bypass surgery. Patients with abnormal rhythm disturbances, some of those patients are going to need electrophysiologic testing. Some people are going to need defibrillators. There's just really a whole bunch of different things that might be done depending on the test results.
And finally, Dr. May, tell us about prevention. Talk to us a few minutes about some of the things that we can do to make our lifestyle better. Well,
I think the key thing would be people that smoke really need to stop. I think that's the #1, you know, correctable risk factor. Since moving to South Carolina, I've noticed that Hardee's stays quite full, so I would say that diet is another place that people should concentrate. And I tell many of my patients, if it tastes good, don't eat it. I think that's a good rule of thumb. If we could adhere to that more, including myself. But diet and of course more exercise, being more exercise conscious and, you know, keeping your weight under control. These are all important factors. Of course, controlling your blood pressure and your diabetes and paying attention to cholesterol elevation. If your cholesterol is tremendously elevated, you probably, you know, should consider being on medications to get it down.
Well, thank you, Dr. May, and thank you, the staff at Advanced Cardiology. for helping to keep the people in the PD heart healthy. Remember, it's your heart and it's your choice, so choose Advanced Cardiology.